Hello, everybody. Good morning, good afternoon, and good evening. Today, we're going to present to you, of course, our new webinar, 5 Ways Healthcare Tech Uses Rocket.Chat for a Better Patient Outcomes. My name is Bert Mons. I'm heading up the solution engineering within Rocket.Chat, and today we're presenting it together with my colleague Pavitra.
Hello everybody. Good morning, good afternoon, good evening. I'm Pavitra from the product marketing team. And today, Bert and I are going to be talking about a lot of interesting things, and we're going to have some exciting live demonstrations of the real world scenarios in the healthcare space. Thank you
Perfect.
all for joining us, for taking some time out and joining us today. And also, do let us know where you're joining from in the chat section. During the course of the presentation, if you've got any questions, please feel free to ask them using the questions tab. And if you've got any concerns, just post them in the chat. And we've got a panel of experts who's sitting right here to help you and answer your questions.
Perfect. Thank you very much. I will start sharing my screen, and
Mhm.
then we can see the presentation ongoing. So let's hide this.
Awesome. I hope everybody can see Bert's screen. So, like Bert said, today we're going to be talking about 5 ways in which healthcare companies across the globe are using Rocket.Chat for better patient outcomes. And in today's world, when we actually come to think of it, digitization, technological enablement, and automation are affecting industries in profound ways, and healthcare is no exception. It is true that industries across the board have been jolted into a new reality created by the pandemic, and this is especially true for the healthcare sector, but because it has had to react faster than the other industries. So it is safe to say that the pandemic has added urgency and accelerated the change process for healthcare to become more digitally enabled. So, to begin with, we'll see how the healthcare industry has evolved over time and why telehealth is the need of the hour. Rocket.Chat is helping healthcare companies especially, to deliver quality patient care by making it super easy for caregivers, providers, and patients to securely collaborate. And later during the course of this presentation, Bert is going to be showing you a live demonstration of how Rocket.Chat can be used to provide superior patient care by sharing notes on patient appointments. How can you schedule them? How can you centralize all your healthcare conversations in a single HIPAA-ready messaging app? And how you can transform your entire patient experience by using chatbots. But could you please move on to the next slide? Awesome. So let's look at how the healthcare landscape has evolved. As the healthcare industry moves towards digitization, healthcare providers are handling an increasing number of sensitive documents. So this makes security a top priority for hospitals if they want to keep their patients' data safe and protect their organization from cyber attack. Which is why this year healthcare privacy and security have taken the center stage, and with a lot of hacks and data breaches becoming more common, it is extremely crucial that businesses take necessary steps to protect sensitive information, which is the patient data. And also, not just that, like how I addressed about the pandemic and how it has sort of expedited the advancements in the healthcare industry, healthcare consumers also today are changing, and their expectations for convenience, affordability, and quality are redefining how they engage at each stage of care that's being delivered. So as the healthcare industry steadily rebounds, there are many practitioners who are working towards bringing telehealth to the mainstream so that they can improve the access and the quality of patient care. Not just that, they can also reduce the healthcare costs and they can alleviate the burden on hospitals. But could you move on to the next slide, please? So, in the recent past, we've seen a lot of innovation that's geared towards improving the access to healthcare services. For example, I think recently in Colombia, we had an increased number of consultations done by telemedicine tenfold during the pandemic. So clearly, healthcare delivery is moving outside the four walls of the traditional healthcare system, and there's also a need. I would say, a growing need for a collaboration model between the needs of the patients as well as the needs of the physicians on the other side. And more interestingly, as you can see, this has been a quote given by the American Medical Association. This year will become more well formed in terms of the hybrid health solutions, and with on site clinics which have been recovering, traditional providers will also be looking to partner with a communications and collaboration platform to implement the hybrid solutions that offer multiple touch points on a single system. And I could just think of an example to tell you. The Scottish Government's remote consultation service. Now, the Scottish Government's Near Me consultation service uses Attend Anywhere for healthcare consultations. And it is a prime example of how flexible healthcare has maximized over the past year. Because the remote consultations a couple of years back was around 7,000, and now it is over a million today. And in a recent survey also, which was conducted for about 5,000 patients and clinicians, 75% of them said that a service like Neomi will remain a valuable service any day owing to its benefits. But the next slide, please. So, with such advancements, right, healthcare data breaches have become rampant over the past years, and I think it's very shocking to know that 30% of all the data breaches that have been recorded in the past year were from the healthcare companies. And also, a few years back, I read a stat somewhere that about 77% of all the recorded data breaches were in the healthcare sector, which is like three times as many as breaches as all the other sectors combined. This is super shocking because healthcare data breach cost is the highest of any industry, and it stands at $408 per record, and millions of records are breached each year, leading to the astronomical costs when you actually draw the line. But yet, it is very sad to know that the industry invests less than 6% of its budget on security measures. So, one of the most controlled and at the same time attack sectors is the healthcare industry. Do you have you ever wondered why? But the next slide, please. The reason why healthcare is like one of the most affected sectors across all amidst all the industries is because the healthcare data is extremely valuable on the black market than the financial data relatively, because financial data is just shut down quickly before cyber criminals can make use of it, whereas healthcare data can be used to commit identity theft for much longer. Also, additionally, organizations in the healthcare sector tend to have larger databases, making them more attractive targets. It's safe to say that healthcare industry, owing to the value that it holds and also how easy it is to target, healthcare industry is becoming a primary target for cyber criminals across the world. That is why more and more regulations are initiated to control access to personal data and prevent any violations of patient confidentiality or other breaches. So, like you can see, as mentioned in the stat on the slide, PHI, which is the personal health information, is 50 times more valuable than the financial data, and each medical record is actually sold for about on an average for $80 in the black market. This concludes what I've been saying, that patient and what all of us know, that patient data is super sensitive, and all the more reason why you need to be embracing a very secure approach when it comes to collaborating and engaging with your patients. So, introducing compliances such as HIPAA and GDPR we have seen that it has had a beneficial impact on data safety, both for the patients and also for the healthcare providers on the other side. Now, these regulations show that the organizations, no matter how sensitive the data is, should be taken care of and facilitate efficient patient data management. They also ensure secure storage, transfer, and use of the health information. Therefore, we've been noticing a pattern where healthcare organizations of all sizes, right? I mean, it's a myth that only larger healthcare companies get attacked. It's also the smaller healthcare companies. So, healthcare organizations of all sizes are increasingly relying on digital tools to improve their patient care and also increase the efficiency. With the right tools and resources, hospital cybersecurity can be dramatically improved. Also, one of the greatest benefits of the information technology era is interoperability, or rather, the ability of computers to easily share information. So, in addition to having one primary physician, it's not it's not uncommon for people with certain health conditions to have several health specialists, right? Like if I was to just give an example, a fairly healthy person may need to visit his or her primary care physician for overall health, which involves a lot of departments and a lot of specialists. So, the other physicians may also want to be aware of the medications prescribed by their colleagues, or might want to look at the patient vitals. All of this needs to be centralized and it needs to be shared in a very secure manner. So that's also another requirement, and that is also a reason why healthcare becomes a primary target. Because the downside is when you share health information, you are either there comes the risk of violating patients' personal health information or having it stolen by a cyber criminal. Because with so many sophisticated hackers looming over the cyberspace, the security of health information when it's being shared, or wherever it's getting stored or when it gets transferred, is definitely subjected to risk. And that brings me to actually one interesting point, because the 21st Century Cures Act, as you can see in the slide, calls for enhanced requirements for the IT interoperability and more precise language around information blocking within the healthcare industry. Now, this act provides for financial penalties for the healthcare providers and vendors who don't meet certain interoperability thresholds. So, on one side, we see the need for interoperability, and on the other side, we see what happens when you actually violate the interoperability thresholds. And also, not just that, the penalties for HIPAA violations can be severe. And just this year, okay, the stat shows that the number of financial penalties have increased, and we've had about, I think, 17 penalties this year. So let's just, on that note, let's take a look at the biggest healthcare breaches. And what's very important is the takeaway that we have from each of these breaches. Let's not look at why it happened, but let's look at what can we do to prevent such breaches. Uh, for example, the Shields Healthcare Group was hacked, and the breach affected about 2 million people. Now, Shields offers imaging and outpatient services throughout New England, and it just said in a statement that it was alerted to suspicious activity that may have involved data compromise. Now, this data may involve information such as names, social security numbers, date of birth, address, and other information. But the key takeaway is we could have mitigated this risk by using a HIPAA-ready app for communication. So you need to ensure that you use an app in your organization for communication, collaboration, for delivering healthcare services, and it needs to adhere to all the healthcare regulations. And that's what we saw at the beginning of the presentation, that healthcare is the most affected sector, and that's why we've been having a lot of these regulations coming into the picture. And the next one is about the Broward Health, which the breach actually affected about 1.3 million patients. It's because someone had gained access through a third party medical provider, and they again had access to private data, which included the patient names, date of birth, social security number, and all that. And we could have easily avoided if there's a means for you to have to keep tabs on all the endpoints that connect your network, so that the minute you detect some suspicious activity, you can take necessary actions to mitigate this risk, and you can actually bolster the security of your entire network by ensuring that the endpoints that connect your network are monitored, and also you've got certain control over from where people connect and from what devices they connect. And the next one is about the Morley companies, which was like quite famous because this hacking incident affected over, I think, over 500 plus people, 500K plus people, making it the second biggest breach we've had in this year. For the first quarter of the year. The company said that the attackers had gained access to all the personal information of the patients. And also, one key takeaway from this breach is you need to be implementing data leak prevention strategies, especially when there's a lot of information that's being exchanged, like we saw in the previous slide. So these have been a few of the biggest healthcare breaches we've had, and it's very important to incorporate these lessons that we've learned from these breaches. With the next slide, please. So the pandemic has changed many things in healthcare, but one of the most remarkable changes that I've noticed is how patients interact with their providers, and this has changed drastically because previously I think barely just 10% of patients had ever interacted with a healthcare provider, like using a virtual connection. But the pandemic just increased this number manifold times because today I think about 75% of people are very comfortable accessing the remote consultation health services. So it's safe to say that one of the silver linings of the pandemic has been pushing the digital health adoption to the forefront. But when you come to think of it, telehealth isn't a new idea or a need. The concept of home based medical care was mentioned as early as 1800 because since then, healthcare professionals have noted the usefulness of remote treatment and monitoring of patients. And also, telehealth utilizations have steadily increased consumer willingness to use telehealth options.
So I see that we do have a few technical issues. I'm sorry for that. So I think that my colleague Pavitra is having right now some connection issues. So let me start the proceeding. Um, as Pravita just mentioned, so of course there's a lot of things happening right now in the market, a lot of challenges happening there, and for that reason also we see the rise of flexible healthcare in a post-pandemic world. So a lot of healthcare solutions that are helping you, that a patient is requesting also to become more digital. We also requiring more secure solutions and making sure that you also can help with uh, that you also can help with an healthcare platform that's able to deliver this type of patient requirements in this type of secure world. Of course, we see that we would like to give and get the quality care anywhere. You see some very important numbers just to highlight a little bit what are patients expecting from doctors' engagements, what are some consumers expecting, and of course also if you see that how can we also improve the different types of healthcare providers between a patient and between a doctor.
Thank you, Bert, and I'm really sorry. I had some there was some technical glitch, and I just got thrown out of this environment. But yeah, I'm back, and I hope all of you can hear me clearly. So, like Bert was saying, I think the telehealth usage has surged because consumers and providers sought ways to safely access healthcare services and also be able to deliver the healthcare services. Now, this has born out of the necessity which has been enabled by factors such as there's been increased consumer willingness to use telehealth and also increased provider willingness to use telehealth because telehealth utilization has stabilized at levels of 38% higher than how it was before the pandemic. And the concept of telehealth started as a way to better access healthcare and collaborate between clinicians. And new data has been added, so communication capabilities also come into picture. So convenience and accessibility are huge drivers for the ongoing implementation of telehealth options. Of course, along with these benefits is safety, which is magnified over the last couple of years. I'm just going to let you read the stats on these screens because it's all the more, it reinstates what we've been saying from the beginning that it's time that healthcare industry starts stepping into a space where you can give and get quality care anywhere. But could we please move on to the next slide? Now, that brings us to how you can put patients in better control of their own healthcare management, because there are two basic modalities when you come to think of it. One is the synchronous communication, the other one is the asynchronous communication. Synchronous is the ability for a patient to receive live remote care in the form of an on demand or scheduled encounter with the provider. Often it happens through a live audio or a video call. And asynchronous is the ability for a patient to receive remote care in the form of a store and forward. So just think of it as you store some information and you forward it. And whenever it's convenient for the physician, they will take a look at your medical data and will get back to you with on what you can do or would prescribe a medicine. So a live interaction is not required in this case. It often involves emails or messages exchanged between the provider and the patient through a communication software. Now, there are about three types of telehealth. I'm not going to get into the details of it, which is like live video, remote patient monitoring, and store and forward. But could we move to the next slide? So, virtual health has had like an increasingly critical role in care delivery in the recent years, and today more and more healthcare providers are embracing telehealth to help improve patient outcomes. There is clearly a need for better data integration and improved data flow across the various players in the ecosystem. And in the light of the fast proliferation of point solution, which are like overwhelming consumers, payers, and providers alike, there is a need for better integration of all these virtual health related activities into the day to day workflows of clinicians. And this will enable a hybrid care model that combines the online and the in person care delivery. With that being said, I'm going to hand this over to Bert, who will just give us a gist about what Rocket.Chat is and show us some live demonstrations of a few use cases that you could be using, you could start using right away.
Perfect. Thank you very much, Pavita, for the very nice introduction. So indeed, so today I'm first going to show you in a few slides a little bit an overview of Rocket.Chat as a platform, so how we can help you to get a better patient outcome. After that, and we have indeed 5 different demo scenarios that we would like to show you, that we can also show you live there. So there will be a little bit switching from the presentation to the live demos. And of course, in the meantime, don't hesitate to ask any type of questions in the on the chat window. So first of all, Rocket.Chat is one healthcare messaging application. And we are defining this as one healthcare messaging application where you can do 3 different use cases with. So you can see the different use cases on the right side. The first use case that we can help you with is talking with patients. How can you make sure that you can communicate in a secured way between your patients and between you as a healthcare organization? How can you make sure that also these type of patients, that they also can use the channel of their choice? So for example, some of these channels can be a live chat, but some of these channels can also maybe be email or being WhatsApp or Twitter or different types of channels that they can use. I'm going to show you a little bit more an example in a second how we can have a better patient communication there. The next use case is the second use case is how can we talk with different colleagues? Because of course, if I'm talking with colleagues, a lot of times I also would like to make sure that I can get some advice from my colleagues. And what we see right now within different types of doctors, if they're communicating or colleagues who are communicating, a lot of times this type of communication happens via WhatsApp or via type of other channels. We are providing for you an on-premise and a secure communication platform where you just easily can start communicating in one-on-one communication, but also start different types of group conversations. And in these group conversations, you can also do file exchanging and starting up multiple discussions, or maybe also highlighting some colleagues if you would like to get some additional support or some advice. And maybe also a very important use case is the third use case. So third use case is how can we integrate all of the functionalities that I just discussed? How can you also integrate that into your platform? So how can we have the functionalities from talking with patients, the functionalities from talking with colleagues, and also how can you also integrate them into your own healthcare platform? All of the functionalities that we have available are available via APIs. And we have them with iframe integration, we have APIs integration, and all of them make sure that you can have a secured chat engine also integrated into your SaaS platform. It's maybe also good to know is that in this one messaging healthcare platform, we also can help you to become HIPAA compliant. And I'm fully aware that HIPAA compliant is not important in every part of the world, but why is it so important for us? Because this helps us that we are delivering a lot of different product functionalities that specific for patient care, specific for the healthcare organizations, making sure that we can help you to communicate in a secure way. So let me maybe first of all start with the first use case, talking with patients, that omni-channel use case. So what does it mean and what are the benefits from it? So if we're looking at talking with patients, we're most of the time talking with three different personas in this one. So you can see the new patient experience. On the top level, you will see that the first one is Bert. Bert is a patient and he would like to contact via the channel of his choice. In the middle, we see Renato. Renato is a support agent from the hospital. And at the bottom, we do see Peter, and Peter is a team manager. So first of all, if we see Bert, what would he like to do? He would like to reach out to the hospital. And he can reach out over WhatsApp, he can reach out over Twitter, but he also maybe can reach out over live chat. What we are doing is that we are routing all of the different messages, doesn't matter from which channel that are coming, all of the messages will be routed and will be routed to Rocket.Chat. We have some mechanisms that are to make sure that the messages will be routed in a correct way. And we have the option to configure a first-line chatbot. And that first-line chatbot, what can I do? It can request some more details from the patient. It can maybe just ask you in a secured way that what's your name, what's your contact details. So what type of question do you have, for example? If we have all of this information, we are making sure within Rocket.Chat that this message will be routed to the right specialized experts. In this case, this is Renato. And we are making sure that the message that will be sent from, for example, WhatsApp will be routed to Renato, and Renato is working in Rocket.Chat. Renato can immediately see that, hey, this was Bert who reached out. He can already and automatically link to his CRM system or to his EMR system, or can also, of course, automatically already create a ticket. From the moment that we start here a conversation, we will also see that the conversation will be started, and Renato has the possibility to send some predefined responses. And in these type of predefined responses, that can, for example, be that I would maybe like to schedule a call. I maybe would like to doing a live video call, maybe also asking for some specific questions. The main important thing is that Renato is working in Rocket.Chat and the patient can work in the channel that we have configured or that he would like to choose. Renato can, of course, also close the conversation. And what can Peter do? So Peter has the possibility to highlight multiple different departments, for example. So he can define, is Renato the only support agent, or do we have multiple departments available? What are the business hours when these type of departments are available? And what's the security that we also have here available? Next to this, we also have the possibility to have a complete audit trail from all of the functionalities in the system and all of the actions and all of the communications that happen between the patient and between the healthcare provider. Next to this, we also have the complete engagement dashboard where you can see which type of conversations happen. You can get some necessary insights that can be quite useful. So if you're looking at this type of patient experience, we just already mentioned our goal is to make sure that we can have a patient-centric contact center, that your patients can use a channel of their choice, and that we then also can help to have some automated key touch points, making sure that your patient, from the moment that he's asking a question or that he's reaching out, that we can give him the best user experience that he can deliver. Our goal is also to give you the possibility to move from a live chat immediately to a live video, for example, also to make sure that we can provide this excellent service. On the right top side, you will already see a short screenshot for an example chat configuration there, where we just first of all see the patient is asking a question, and then you can just maybe click on a button, where's the location, I would like to schedule an appointment, I would like to ask a doctor. So you can already, let's say, guide the patient already a little bit how to move forward and which type of agent can support you. Our goal is to make sure that you can reduce the phone calls, because nobody likes to wait for hours and hours on a phone call waiting and being in a queue there. But of course, if you're just sending in a message and knowing from the moment that the agent is available and will respond back to you, this helps you to have a way more a better way of communicating. And that, of course, is also going to boost the user adoption. So this was a very short introduction for us as a platform and what we can do also to get a better patient outcomes. What we're going to do right now is we're going to show you also 5 demo scenarios. So in these different 5 demo scenarios, I'm going to highlight a little bit what are these different demo scenarios, and then of course also I'm going to switch screen and also going to show you some live examples here. So the first demo scenario where we can help you with is working with multiple colleagues. Of course, if you're working with nurses, working with doctors, and working in a lot of different teams, you would like to make sure that you can do this in a user-friendly way, tagging the right people and making sure that you also never going to miss any type of conversation. That you can always communicate in a secured way with your colleagues and knowing who has access to which type of information and who doesn't have access to which type of information. The second use case is integrating via APIs. So all the functionalities that we have available about working with colleagues can also be accessed via APIs. So I'm just going to show you some examples in there, how you can do an API call and also how you can integrate this one also there directly into the same platform. Of course, we also have the possibility to schedule an appointment. Because if I'm reaching out to my hospital, for example, they're going to say, oh, next Friday you can come over. We have a free spot there. So how can we make sure that we have this scheduling in a very user-friendly way and making sure that we also, from the moment you have a scheduling, you maybe also have some questions that you also can start some live chats during these scheduling there. Next to this, we also have the possibility to talking with patients. So if a patient is browsing on your website, they have a question, and how can you reach out also in a secured way, but also in a user-friendly way? And last but not least is, of course, the fifth scenario is federating hospitals. Because federating of hospitals, so what's the goal of this one? If we're working with multiple disciplinary teams, all of them, they're working in multiple hospitals and they are looking to communicate about a lot of different topics. We are providing them we are giving them a way to securely communicate with the different hospitals and to make sure they always can set up a secure chat and video between these hospitals. So let me maybe first start with the first 2 use cases. So working with colleagues and integrating via APIs. So I'm going to stop the presentation for a moment, and I'm just going to show you our Rocket.Chat workspace environment. So our Rocket.Chat workspace environment, so as you can see, this is an example environment that we have here available. I have white labeled this one a little bit with a healthcare demo powered by Rocket.Chat. So you can, of course, very easily white label your own environment. I'm going to log in here as a user called Bert. And from the moment that I can log on, I can see here a welcome screen that is again showing me a little bit with the things that are important for me as a user for the moment. Of course, you can also customize this yourself. We have analytics overview, we have an audit trail overview, and we have a quick way also to request some support. As you can see that this is one of the demo environments for the Rocket.Chat healthcare solution. So this is the welcome screen, but maybe more important on the left side, you can also see that all of the different communications that I'm part of. You can see here that I'm logged on here as a user Bert. You can see my presence, you can set my statuses, and you can see some more information from me as a user. But you will also see that we have multiple teams organized here in Rocket.Chat. So one team is a team for the doctors. And why is it so important we're doing this? We're grouping all of the doctors in a team called for the doctors. Of course, you can group this in multiple ways. So we're adding here all of the different teams in these as users. We are most of the time synchronizing your LDAP or your Active Directory to a team in Rocket.Chat. Why? To make sure that if a new team member is joining in Rocket.Chat, that they will be automatically, sorry, if a new team member will be joining your hospital or your organization, they will be automatically also added to the right team. But maybe more powerful for this also that we can also synchronize all of these different teams with the different types of channels. So for example, if I'm right now adding, let's say a new Dr. Pavitra, for example, that I'm adding in my LDAP environment, she will be automatically added to the team doctors, and she will be auto joining the conversation called emergency. And of course, she also can join specific on her needs, also the oncology or neurology channels. In the example that I have here about the channel, it's channel or a group conversation, it's called emergency. So people will be auto joining if they're joining this team. But let me just maybe also open up the different channel emergency here. What can I do in this particular channel? In this channel, I can send some messages. I can just send, so for example, here some messages. I have the possibility to add here some smileys. But maybe also more very powerful to know is that I also have the possibility to also starting some sharing some audio messages. I also have the possibility to share some video messages if I would like to, or maybe also starting some discussions, or maybe also adding files. What I can do is that if I'm would like to get some advice, I can, for example, say, "Hey," and then I have a question, for example, and I have the possibility to maybe tag also somebody here, just to say, "Hey, I have a question, Atlassian." From the moment I'm doing this, that is, I'm tagging one of my colleagues and making sure that my colleagues is not going to miss this conversation. So he will receive a pop-up on his side, a notification to see that, hey, Bert is tagging you. Can you please give an answer on this one? What I also can do as an end user, I also have the possibility here to, of course, giving some reactions, as you can already see here. I have the possibility to also send some replies. So the same thing as I did here is I can also tag one particular user, but I also just can tag everybody in this particular team. And from the moment I'm tagging everybody, as it's what I did yesterday, is I tagged everybody. And on that moment, my colleague Jose, he just already saw the message and he sent a response on this one. So I'm starting a conversation and also making sure that once I'm starting a conversation, I also can have multiple threads ongoing here. What I also can do is that in each different channel or in each different group conversation, I can see here, I can show me all different files that has been exchanged. So for example, show me all the images, all the videos, all the text that has been exchanged. I also just can ask you, what are the notification preferences? What are the text messages where I have been mentioned? Or what are, for example, the start messages? But what's maybe also quite powerful, we also have the possibility from the moment I'm having a group conversation or a channel, I can click here on call and then I can start in a video call. So from a live chat, I can move right away also to video or to an audio call. So depending on which type of settings that I have enabled here. So we can organize our users by teams. We can organize users and conversations by different channels. But of course, I also have the possibility to also just sending some messages with my colleagues in direct messages. So as you see that a few days ago, I also already exchanged some messages with my colleague. And from the moment that I started exchanging some messages, I asked him a question. He shared me also here some files, and based on that, of course, I can again send some responses again and send some reactions. So this is a very powerful way to start communicating with your colleagues and with your internally in the hospital. But it may be also good to know that all of these functionalities that we're showing here, they're also available via API calls. So for you who are a little bit more technical, you maybe already know REST API calls. For the ones who are not so technical, I'm going to walk you through this quickly. So you will see here an application that's called Postman. In this Postman application, I can give you an API call, for example, to create a new group, to move a room, to post a message. So I have a lot of different API calls available. And with the application called Postman, I have the possibility to give you an example API call. For example, say I would like to create a new group. So what's the name of the group and who are the members from the group? And here at the bottom, you can also see the response from these API calls. So what I'm going to do right now is I'm going to start with a split screen. So you will see a split screen. On the left side, I will have my Postman open, and on the right side, you will see my you will see my Rocket.Chat environment open. So first of all, what I'm doing here is that I have my create room, and that room will be patient one. So I'm going to click here on send this API call, and you will see once I'm doing the API call, a new group conversation has been started here. It's called patient 01. Next thing, what I'm going to do is I'm going to show me all different teams. So he's going to show me all different teams that I have available. Then I'm going to click on move this particular team to this particular, move the team patient 01 and assign it to the doctor's team. Next thing, what I'm going to do is that I'm going to assign that we just have created a new channel, a new conversation for between patient 1 and also between patient 1 and between Dr. Young. So I'm clicking here on sending in a message to this particular room. So let me just right now also open a new group conversation we just saw. We saw that, hey, Dr. Hindi, this patient is waiting for you in this particular room. So I can see that we just created a new group conversation between Dr. Hindi, between patient 01, and because of me, because I'm also giving the demo here. So, but we see that we have a secured conversation ongoing between patient 01 and between Dr. Hindi. They can start communicating and, for example, say any type of messaging. But on the moment that they start a conversation, in this particular example, we can see that Dr. Hindi is trying to help the patient 01, but he's not able to help him very well because he said, like, this is not a problem for me. I need to invite the particular other doctor and another specialist. So we're doing again here an API call. We just said, hey, let me just maybe also invite the user internet here. So we're inviting here an additional specialist, but of course the specialist is not all the time monitoring his chat application. So we're going to tag also again Dr. Mihart, and we're going to say to Dr. Mihart, hey, welcome to this room, and we need your assistance here. So as you can see that we're starting from a secured conversation between one patient and one doctor to a secured conversation between his default doctor and between his specialist. So there's a lot of different ways here and a lot of easy ways what we can help you with to make sure that we can start a group conversation, and then of course also doing this via API calls. So this was the first part of the demo where we just showed you how we can working with colleagues and how we can also integrate this via APIs. So the next scenario, what we would like to highlight with you is scheduling an appointment. So scheduling an appointment that, again, we are having 3 different personas here. So we see in the middle, we do have Bert, sorry, on top we do have Bert, in the middle we do have Renato, and at the bottom we do see Peter. So at what can Bert do? Bert is going to browse on a website or via the mobile app, and he would like to schedule an appointment. So they have a web interface available where they just can schedule an appointment and ask it, will it be a physical appointment, video type of appointment? So, and then you can choose if it's online or on location. And of course, while you're scheduling appointments, you can come up with any type of question. From the moment you come up with any type of question, you just ask the question, and this message again will be routed directly to the Rocket.Chat and Pexa platform. On the moment that the message will be routed, we can have a first-line chatbot that is going to ask you any type of questions, and that's an optional chatbot. But most importantly, we are making sure that the message will be routed to the right specialized expert, again to Renato in this case. Of course, also, if we're working here, Renato, he can again see the ticket, he can see all of the history, but Renato in this case also has the possibility to say that, hey, I just see a message from you coming in, so would we maybe like to have a video call just to clarify this for you? He can just click on a button, and from the moment he's clicking on a button, the video call then will start between Renato and between Bert. So as you can see that we have the backup video call started right away from the moment that we have the engagement on. And again, as Peter, he can configure multiple departments. He can configure the business hours, seeing the audit trail, and of course also having the engagement dashboard. So a lot of very nice functionalities available also to just start scheduling an appointment and moving from that scheduling right to a live chat and to live video meetings that we can show here. So we just already talked about the first three use cases. Let's right now talk about the talking with patients. So with the talking with patients is that I'm going to show to you live again. Talking with patients for us means that I'm a patient, I'm browsing on a website. I can see on this particular website some different menus. I have a question popping up. So I have an oncology healthcare needs. And from the moment I have a question popping up, I'm just clicking on the chat icon. From the moment I'm clicking on the chat icon, you can configure as an admin if you would like to have some fields that people fill in. So in this case, I configured it, just the people that can fill it in. And I said, like, we do have two options available: prescription refills or scheduling appointment. These are optional things that you can configure. It's not mandatory. So from the moment I start your conversation as a patient on a website, and I just say, hey, I have a question. What's right now quite powerful is that I send here a message. I can send, of course, also some smileys. I can share also some files if I'm allowed to share this. And I start here a conversation, and I can see that, hey, my spot is number one. And we automatically calculate for you what is a waiting time for this one. In my demo environment, my waiting time is quite long, but just good to know that this automatically calculated. So, and normally if my spot would be number one, I just would have to wait for just a few minutes. So this is the view that I can get as a patient from the moment that I'm again going here to my conversation ongoing here as an agent. What do I see? I right now see here that I also have the pop-up coming in here from queue chats, and I see all of the queue chats that are assigned to my team. I can see them over here, and I just can say, hey, this is one conversation that is where I'm responsible for. So let me just take this conversation. And from the moment I'm taking that conversation, I can just say, for example, hey, I can send some messages back, and you can see that there's some nice conversations ongoing between the patient and between the healthcare provider. Again, I have the possibility to also just send here some voice messages. I have the possibility to also just send here some video messages if I would like to do this, or sending some smileys. I also have the possibility to have some auto responses. An auto response could be like a message that you're using quite often. So in this case, hey, Bert, my name is Bert. What can I assist you today? So some predefined messages that I can see here. Next thing, what you also again can do is that you also have the possibility to also just click on the call button here. So if you would like to enable a call in between your healthcare provider and between your patient, you have the possibility to just click here on the call button, and then a live video call you will start between you and between the patient. So this is one very important thing that I forgot to mention. Of course, again, also if you're having the conversation between your patient and between the healthcare provider, I also have the possibility to, for example, let's say inviting Young, for example. So you can say, I would like to invite Dr. Young to this conversation. So again, we can also invite multiple people to the same conversation to make sure. We also have the possibility to also forward a chat, so forward a chat to a specific other department or forward it to some specific users here. So you can see there's a lot of different functionalities available. We can also send you the transcription if you would like to have this. But of course, also if the conversation is closed, I also have the possibility to just start and closing a conversation here. So this is a quite user-friendly way to have the interaction between the patient and between the healthcare provider, so we can also talking with patients. So the fifth use case that we would like to highlight a little bit is federating different hospitals. Federating different hospitals is a quite important one. Why? Because we would like to make sure that all of different healthcare providers can communicate in a secure way with each other. And we also are aware that not all of these healthcare providers are having Rocket.Chat. Of course, we would love them all to have Rocket.Chat, but we also are fully aware that This is not the case. So that's the reason why we have the possibility to use the Matrix platform. So Matrix is a secured open source communication platform to allow multiple organizations or multiple chat communication platforms to communicate with each other. So it could be that you can say that, hey, I have hospital one would like to communicate with hospital two and not allowing with hospital three. So we have the possibility to say in our configuration that what are the hospitals that I would like to whitelist and what are the hospitals that I would like to start maybe also blacklisting, making sure that we can set up a secured conversation between multiple organizations. In the secured conversations, I can start in a group conversation, for example, between hospital one and hospital two. And from the moment that I'm receiving this invitation, I will receive an invitation and I have the possibility to accept this invitation. And after that, I can start communicating between hospital one and between hospital two. This is quite powerful because we're then providing multidisciplinary teams to communicate together on a secured way. What is also quite powerful is all the functionalities that you just saw on the platform, how you can start a team collaboration. They're also available to start with multidisciplinary teams. So we also have you the possibility to move not only from chat, but also just click on the call button and, for example, start their PACSIP video call there right away. So we just showed you 5 different ways that maybe also can help you to start communicating and getting a better patient outcome. Next to this also, of course, I would also highlight again what we just already mentioned. So what is, for according to us, quite important if you're looking for an HIPAA compliant messaging application is, first of all, we are helping you with a self-hosted software. So this means that you are always owning the full data. We are also providing a full Active Directory integration. So, for example, if you have new doctors, new nurses coming in, it will be all automatically set up and you don't have to manually start defining all of this. You can also link this Active Directory integration automatically to our role-based permissioning that we also have available. Providing, of course, also an end-to-end encryption, making sure that never any type of sensitive data can be lost. And of course, also that if you're allowing this, that you also get the full patient conversation history available only for the right people, making sure that if it's ever necessary, just that you have to show the history, that you always can go back and show the history there. And of course, next to this, of course, also the HIPAA and the SOC 2 compliance availability. So thank you very much. I will also right now would like to hand over to my colleague Pavitra, and maybe also just she also can give you maybe some examples here.
Yes, thank you, Bert. We hope, I mean, that was great. We really hope this was super insightful and actionable for all of you who are watching us. I just wanted to conclude the session by talking about a couple of customer testimonials that we've had. And one of our customers onshore has been a cybersecurity company, and they think Rocket.Chat is strong enough for a cybersecurity company. So then just imagine how secure it would be for whatever business you're in. So this is just more of reinstating the fact that Rocket.Chat is secure. Like Bert mentioned, you've got complete ownership of your data, and is probably one of the best collaboration solutions out there if you're looking to start using one. But could we go to the next slide, please? And we also have another customer of ours, Seeking Alpha, who have been able to double their subscription revenue using Rocket.Chat. And we've got a lot more. You can check out our website. But these are just a couple of customer testimonials to show you the kind of impact and the kind of business metrics that Rocket.Chat is going to help you move the needle on. That brings us to the end of this question. And it's poll time before we start taking a few questions. So just click on, you'd be able to see a poll tab towards the right corner of your screen. Just click on the poll and please start voting. So you've got to click on the poll tab and you'd find a question. So just please answer the question. Awesome. So I think if you're done answering, we can move on to questions. So we're now opening the floors for some questions. We've already been getting a lot of interesting questions. I think most of them are answered. So we'll see if we have any open questions. Awesome. So, but we've got a question regarding the end-to-end encryption. Does end-to-end encryption work in omni-channel chats too?
It's a very, very good question. Thanks a lot. Yes, it works for the part that we can control. So this means that all of the communications that we are setting up, we can also make sure that part will be encrypted. For example, if you're connecting with Facebook or with Instagram, that we can encrypt until the part where until the part that we have in control, and then for the rest, of course, then we're also looking into the APIs from Instagram or for Facebook or the other solutions for the rest of the encryption. So we can encrypt always until the one that we have available.
Great. And we've also got another a little broad question. How can you, so you just showed us the use case for chat engine and how you can use our chat engine. Have you got some best practices that you can tell us, like top of mind, that we can actually implement without compromising on the data privacy?
Best practices, you mean?
Yes, when you
Okay.
use chat engine.
Okay, yeah, very good, very good. Yeah, so we do have some best practices just to make sure that we most of the time would like to have a conversation about how can we help you with security. How can we align your internal security already in your organization and link this one directly into Rocket.Chat with the teams-based, with the group-based security, with the encryption, with the role-based permissioning, all of these functionalities. And we do have a team that can help you also in there, just to make sure that we also just can say what are the things that are necessary for you and how can you can get started in a very secured way there. I think these are probably the first things. Next to this, also we do have some documentation available also about our APIs. To make sure that we also the things that I just showed you with the Postman and REST API scripts, how you can also set this up yourself also in an easy way.
Awesome. So I think we've answered all the questions. Let us know if you've got any other questions. You will also be receiving a recording of this session after this webinar. So you can, in case any of you are unable to make it, or if you would like to, again, check the video for references, you can watch the recording. And before we wrap up, we've got one last question, Bert. If we use the enterprise level, where will the data be hosted?
That's a very good question. So there are two answers on this one. So first of all, you have the option to host it in your own data centers. So Rocket.Chat is available as an on-premise or as an own managed solution. So we see a lot of customers who would like to make sure that the data is stored in their own location. The second answer is that we also have the possibility to help you with SaaS solution. So that means that Rocket.Chat then in that case is hosting the solution for you. And then you as a customer has the option to choose if this will be an EMEA based or it will be in the US or some other types of the world where your data will be hosted. And for example, for the EMEA customers that I know, for example, this will be in Germany and in France, I think that we can choose from that side. So it really depends on which type of region that you are and what are your requirements where your data will be hosted. Our goal is always that you are owning your data and you can decide where your data will be managed.
Awesome. So that just brings us to the end of the session. Thank you, everybody, for joining the session and for keeping it very live and engaging, because we've been getting a lot of interesting questions. So thank you, everyone, for joining us. Until next time, see you. Bye bye.
Thank you all. Bye bye.